everyone, Dr. Jay Mehta again. Today's class is going to be on Tacrolimus and the application of Tacrolimus in reproductive immunology and its entire spectrum of diseases. Basically, everybody has to understand that Tacrolimus is a calcineurin inhibitor. Don't get into so much details if you are a patient, because just remember one thing: it is a broad spectrum immune suppression and it is being used in transplant medicine by our transplant physicians and transplant colleagues for a huge number of years. So what basically happens is tacrolimus and combination of thymosin is reserved by all of us to be used only in those cases which are absolutely refractory, because tacrolimus enters inside the T cells, it binds to a specific type of receptors and blocks the calcineurin, and this entire complex actually reshapes the immune system by reducing the attack of the immune system on the native cells. Now this was very complicated, right? So just remember, tacrolimus is like that policeman who does not allow anybody to attack anybody. All right? That is why it has been experimented and used even in cases of reproductive immunology after understanding all the suppressive effects, understanding the risks and benefits, because like how it suppresses broad spectrum, it suppresses the bad uterine natural killer cells, it helps in T regulatory expansion, it helps in a very good balance, so Th2 goes up, all these types of things it will do at a molecular level. Now, if you are a patient, see, majority of the patients who are going to contact us are going to be patients who have tried all these therapies. See, in India, it is very common to have an unинdicated LIT. Most of the people would do IVF at commercial centers. Those commercial centers would do absolutely unindicated LIT. That LIT will then fail. This LIT is done by charging you 50, 60, 70,000 rupees just to add to revenue. There's no indication. So what happens is, most of the times, these patients think that they have undergone so much immune therapy and everything has failed. And unfortunately, quite a lot of them have not even been evaluated properly. There are multiple reasons, so everybody is to, take care of such type of situations. That is the situation when you have a refractory patient. You want to give that particular patient an experiment with tacrolimus, because it is that last resort, most powerful person, okay, who is going to act on the immune system. Now, of course, there are pre-investigations. Your kidney function has to be good, diabetes under control, liver, kidney test, and everything has to be fine. And then what we do here is we send you to our nephrologist in-house. So we have a nephrologist who looks, because he is a great guy, he has been studying transplant medicine for so many years. So how to give tacrolimus and how to adjust the tacrolimus for the patient, it is something which is very easy for them by looking at multiple parameters. But the standard thing which you should remember is that standard dosaging of tacrolimus is 1 milligrams per day. Now, the obvious thing for an intelligent patient is going to be, oh, if you are giving me 1 milligrams per day, this is also used in immunosuppression. I think it is risky. I will not use it. We do encounter such stupid patients time and again. And in medical practice, we have realized that most of these patients know nothing about the subject. So remember, for transplant medicine, the dose of tacrolimus is much higher. In reproductive immunology, we need to use it much safer, much lower. Despite that, your clearance protocol has to be equivalently good. That means, despite being a reproductive immunologist, I don't take the lead and prescribe it. I always ask my nephrologist to calculate the dose and prescribe it. And thankfully, thanks to Siddharth Lakhani, he is our nephrologist, so many patients have had such beautiful benefits even without visiting the clinic once. All right, all of them are managed online. Scientifically, it is brilliant because your success rate after addition of tacrolimus in a refractory protocol almost doubles. Proven scientific data, more than thousands of patients have been studied. We also add thymosin in certain special situations, because thymosin is shown in our series to increase the live birth rate, right? And that is very important for us. That is why, my dear friends, all of you should know, understand, and study this beautifully, perfectly well, so that you realize that tacrolimus can be used effectively if you are a patient who is going through multiple IVF failures or previous multiple abortions.